It's a pleasure to talk to you today. I'm Dr. Cristiane Squarizi, a oral and maxillofacial pathologist, principal investigator, and faculty at the University of Michigan School of Dentistry. Today I will talk to you about a specialty of oral and maxillofacial pathology, also known as oral pathology. So what is oral pathology and what does oral pathologist do? A oral maxillofacial pathology is one of the 9 dental specialties in the U.S. This specialty is internationally recognized. A oral pathologist is a professional that works on a diagnosis of diseases. He or she performs the analysis of the biopsy to obtain a more definitive diagnosis. Note that a biopsy is a procedure to remove a sample of tissue from the body to be analyzed in a laboratory. The oral pathologist participates in the diagnosis alongside with the radiologists, oral surgeons, oral medicine practitioners, and oral healthcare professionals. As you can appreciate, oral pathology is an interdisciplinary and interprofessional specialty. In addition, the oral pathologist communicates the findings and diagnoses to dentists and healthcare professionals. The result of his or her work will impact treatment decisions and choices as well as referral. Why do I say that? How can a treatment be determined if a doctor doesn't know what the patient has? This concept and relationship between diagnosis and treatment was well established by Dr. Charcot in the early 1800s. Quote, "To determine how to treat a disease, one must learn how to recognize it. The diagnosis is the best trump in the scene of treatment." Furthermore, if the diseases and their causes are determined, steps to prevent disease might be applied in the clinic. For many conditions, the molecular changes and causes has not been determined yet. Therefore, lots still need to be understood. The oral pathology specialties is an excellent fit for doctors who are also considering working in the academia in basic and translational research. What are some examples of diseases in the oral cavity? Interesting, the mouth is an important organ with many functions. It is also prone to several medical and dental disorders because it is made of different tissues, including bone, salivary gland, muscles, fat, mucosa. These tissues can be a source of diseases. The most common disease in dentistry is caries. Advanced stage caries can lead to pulp death and the development of periapical infections, which are infections at the tip of the tooth. If left untreated, these conditions of the cavitated tooth can even lead to death. Caries can be very painful and even cause infection inside of the bone. You can appreciate bone destruction that is identified by the red circle on the X-ray picture on your right. Other types of cysts can occur in the oral cavity. Some common ones can be found in children, such as the eruption cyst. Another example is shown on the right. It is the dentigerous cyst. Tooth structures can originate tumor-like malformations. Tumor from teeth? That's right. Odontomas are the most common odontogenic tumors. An example is in the X-ray image on the left. There are 2 types of odontomas, the compound and the complex forms. The compound odontoma is well organized, which means that the tooth-like structures can be identified, but the complex one, the tooth is poorly organized mess. Another example of odontogenic tumors is the ameloblastoma. Odontogenic tumors are a growth composed of cells and tissues that originate teeth. The ameloblastoma is the most common odontogenic tumor after the odontoma. Clinically, it is locally aggressive and invasive, cause bone destruction, although it is a benign and slow-growing tumor. And painless expansion of the jaw is seen in both photograph and X-ray. If left untreated, it can grow even to larger size. What are other lesions and tumors that occur in the oral cavity and surrounding structures? Well, where are your salivary glands? The salivary glands are found in and around the mouth and the cheeks, and they can also give rise to tumors. Here are two examples, one located on a major salivary gland, the parotid, and another inside of the oral cavity, more specifically in the posterior palate. Although some of the lesions that you saw until now were cancer, most of the lesions inside of the mouth are reactive lesions. That means that they developed in response of local trauma and sometimes repetitive and chronic injury or inflammation, then can easily be treated, or in some instances, they may resolve on their own. The picture is an example of a reactive lesion. It is a mucocele, also known as mucus or saliva retention cyst, which usually appears after trauma from biting the lower lip. Mucocele is reported in patients of all ages, but in most common in children and young adults. The oral squamous cell carcinoma is the most common malignant tumor found in the head and neck area. Common names are oral cancer, mouth cancer, tongue cancer, tonsil cancer, and throat cancer. It is the most common malignant cancer in the oral cavity and is among the 10 most common cancers worldwide. These include cancers that occur in the mouth itself and on the very back of the mouth, an area called oropharynx. For more than a decade, there has been an increase in the occurrence of oral and oropharyngeal cancers. The picture in the right is an example of advanced stage oral cancer. Early stage oral cancer and even precancerous lesions can be identified during a routine oral examination in the dental office. Prevention is the best approach to stop cancer. Dentists and dental professionals can also provide information and work with patients to prevent behaviors, exposures, and other factors that may increase the risk of cancer. Oral cancer takes more lives than cancers we routinely hear about. It's more deadly than cervical, breast, prostate, Hodgkin's lymphoma, skin, and many other cancers. Other cancers is mostly associated with the use of tobacco, and its effects might be potentialized by alcohol consumption. The virus known as HPV also plays a role in the head and neck cancer. Do you know anyone who had a head and neck cancer? Here are some well-known people and celebrities that had oral cancer. Other examples of stars that had oral cancer are listed at the Oral Cancer Foundation website. For more information in the involvement of HPV in the development process of oral cancer and oropharyngeal cancer, please take a look at the link associated to this presentation. We made available a link to a publication from my laboratory, which reviews the HPV infection rule in head and neck cancer. Information available in recent studies and by the CDC, which is the Center for Disease Control and Prevention in the U.S., show that nearly 80 million people, about 1 in 4, are currently infected in the United States. About 14 million people, including teens, becomes infected with HPV every year. Prevention remains the best strategy to avoid HPV infection and, consequently, HPV-associated cancers. Recent association of HPV with a subpopulation of head and neck cancers open a potential to use the HPV vaccine as a preventive therapy. It is well documented that HPV vaccine protects against HPV infection. Looking to the future in cancer management, we see the development of novel technologies and therapies, like gene editing with CRISPR and immunotherapy that have been shown promising results in other cancers and diseases. I'm also excited about recent studies coming from the epigenetic field. The epigenome, along with other functions, links the expression of genes with the environment that we live in. Therefore, novel studies in this area may help us to better understand how cancer cells respond to the tumor microenvironment as well as chemotherapy and radiotherapy.